Okay, it's 1 o'clock. We'll go ahead and get started. I want to welcome everybody to the Calhoun County Joint Information Center briefing. It's Wednesday, September 16th, 2020. On behalf of the JOC Emergency Management Team, which is Mike McKenzie from the City of Battle Creek, and myself, Dirk Dunham from Calhoun County, I want to welcome everybody today. Kind of a long agenda. We'll get through it. Next slide, please. Next slide, please. Okay, fantastic. Here's the agenda. We have Eric Pessel in today. Welcome, Eric. I'm going to talk about the current situation, confirmed cases, and hospitals and total tests that are taking place. Also, schools reporting via MDHHS, the latest information on that. Eric will be covering that. Battle Creek City Manager Rebecca Fleury will be covering the general guidelines, some general guidelines, and a court update from Chief Judge Mike Jaconet. The Triple E, which is starting to show, and a neighboring county, Eric Pessel, will cover that topic. Summit Pointe update, Rebecca Fleury, and local business update, Kara Beer. And then finally, we'll have comments from representatives open to elected officials or their representatives. Next slide, please. Okay, with the current situation, I'd like to go ahead and turn it over to Eric Pessel.
Thank you, Dirk. So our current situation as of today at 11 a.m., we're at 1,046 positive cases. We've had 43 deaths reported in total, and we've had 129 cumulative hospitalizations from Calhoun County residents. Just a reminder that this information is updated once daily, Monday through Friday. Next slide, please. Currently, we have 6 persons in the hospital in Calhoun County. Those are our 2 hospitals, Bronson Battle Creek and Oaklawn combined. We've overall, since the beginning of this, the health department has released 862 of our positive cases from their isolation order, and we've released 938 people from their quarantine orders. And that's a significant amount of people, and following, you know, what the staff have to do is basically that's a contact every day for each one of those people for sometimes up to 14 to 20 days. Next slide. Important information on this slide is to see there about August 24th, we see a spike in our case count. And that happened and lasted for about a week and a half to 2 weeks. You can see where it spiked even higher than our mid-April, which is when we were in the height of this. The fortunate thing is that we're seeing that starting to come down. As you can see by the September 14th date, we're starting to come back down, which is very important. So we did see a surge. It lasted about 2 weeks. Most of that surge was due to some local outbreaks that we had. We had an outbreak happening in another county, but we did have 20 Calhoun County residents that were part of that outbreak. They worked there. So, you know, we can basically look at that spike as being, you know, people that were gathering. There was some church, a couple of churches that had an outbreak, and other private gathering locations where more than one person from that gathering ended up being sick. But the good news is it looks like it's a trend that is coming back down, which is something we're watching very closely. Next slide.
Thanks,
Take
Eric.
this-
I'll take this one. I think that we have to continue to remind people of the CDC general guidelines. I know we've all heard it, and as we start to do things like go to work, go to school, start to go out into some of the businesses that have been able to open, it is still very, very important that we continue to follow the CDC guidelines. Wash your hands with soap and water for 20 seconds. Some people say happy birthday twice. I sing the alphabet. Whatever gets you to wash for 20 seconds, that's what we need you to do. And then if you don't have access to soap and water, please use that sanitizer. And it's important to check that alcohol. It needs to be 60% alcohol or more to be effective to destroy any virus that may be present on your hands. Please avoid touching your eyes, nose, and mouth. And avoid close contact and maintain that social distancing. Remember, 6 feet is still required. So follow the little circles at Meijer, follow the little circles at CVS and Walgreens to maintain the distance wherever you're at. Then cover your mouth and nose with a mask and make sure that you clean and disinfect frequently touched surfaces. So anywhere you go, whether it's public or private, please make sure that you're extra diligent about clearing and cleaning and disinfecting surfaces that people may touch, not only yourself, but others. Thanks. Next slide.
Okay, and I'm going to go back and take this slide over. And so there's been a lot of work going on with our schools, and we have a lot of our schools that have opened up throughout the month of August and early September. And the first bullet on here is talking about the Michigan Department of Health and Human Services is going to be reporting on their website once a week outbreak information by the individual school building. They'll actually name the school, name the building, name the town that is located in. Now that information that they're getting, they will be getting from the local health department, so from our public health department. We will be uploading that weekly, and certainly with that type of information, that's something that we have already would have already been working very closely with the school district. They will obviously know that they're experiencing an outbreak, and we would be well into our investigation at that point by the time it would be placed on the state's website for all to see. You can see there they're going to post it at 3 p.m. on Mondays. I think we upload the information every Friday. So that's how they're going to post it, is every Monday. And then I really want to focus on the third bullet because we've already seen, just since our schools have been back in, we've certainly had cases at schools. We've had cases with sports teams. We have a soccer team that's now quarantined. We've had a football team quarantined. And we've also had some students quarantined from school. And I think it's important for everybody to understand that the protocols these schools put in place are extremely important to stop the spread of the disease. We cannot stop a student or a teacher who may have picked the disease up somewhere else to go to school, and then we find out later they test positive and they were within the infectious period and they happened to be in school. We can't stop that because they don't have symptoms at that point. But what we can do is if we're following proper protocol, and I think that's really important, if they're following that social distancing, if they're following the mask wearing, then we're not going to see the spread. And that's what I would define as success. It's not that we won't have a case that's associated with the school, it's that we won't see an outbreak or multiple cases that were spread from the school. And to date, we haven't seen that at all at any of our schools. The individuals that we have that were positive, it appears would have picked that up somewhere else. So that's what's important about the schools. They all have protocols in place, and as long as they're implementing them and following them, it's really helping with the contact tracing, and it's helping to determine who is and who should or shouldn't be quarantined. And I would just like to say, in case anybody has, heard about some of the issues that have been going on out there, that, this is all new for everybody, even the health department. It's not very often that we're dealing with having to potentially quarantine 50 or 100 people at a school because of the contact of an individual. So we're working through that. We're learning from it. And I think moving forward, we've got a great plan that we're working with the schools on to be able to mitigate the risk and really provide them with a sense of almost security that that we're doing what's in the best interest of the kids, of the teachers, of the staff, and of that school community. And I'm pretty excited with the work that we've put in, and I think it's going to lead to good things in the future. But just so everybody knows, we have had some cases out there, but so far we haven't had any cases associated by the school. And with that, I think that's it for me at this point.
Thank you, Eric. We're going to be back to Eric in just a couple seconds. Right now, we need a courts update from Chief Judge Jackinet.
Thank you. I did ask to get towards the top of the agenda because I have a hearing at 1:30, and I just wanted to make sure if people had desire to hear the court's information, we had a chance to get that in before then. I do have the administrators on who can answer questions at the end if there are any questions after I've left. But I think everyone is aware that we have our courts open to the public as it relates to having the hearings conducted. We have a almost entirely, we are conducting our hearings through a virtual platform with the Zoom and the Polycom. There are some cases where we are allowing people into the Justice Center by appointment for hearings. We're at the phase right now through the Supreme Court, State Court Administrator's Office, phase 2, where that is still just appointment only. We've had great cooperation with the Sheriff's Department on coordinating these appointments and getting people in and cleaning those areas where the people that are coming in are coming in for the court hearings. We expect that to expand, but still on an appointment basis for the time being. But the thing that I really wanted to make people aware of is we do have jury trials in the planning stage where we're looking at possibly the week of October 12th, hopefully the week of October 12th, if everything goes according to plan, where we can bring jury panels into the building, have them socially distanced. We've made some modifications within the building to accommodate where jurors would deliberate, literally taking down a couple of walls that we had separating 2 smaller jury rooms to make 1 large jury room where people can be spaced out properly and still be able to deliberate and have restrooms available. So some of that planning is really intense as it relates to certain things you just wouldn't think about ordinarily. When the old way we would bring in jurors, we'd just bring in a group of maybe 60 people for jury selection on a capital case and bring them up into the jury selection room and then bring them over to the assigned judge when it was time to pick the jury. And it's entirely changed now. We have different staging areas within the building where we're going to have different pods of people come in and reduce the number of people that we have coming in, spacing people out differently than we would ordinarily do it within the courtroom. So there are steps along the way that we've been planning this, and it looks like we're going to be able to do that. If trends continue, we should be able to do this that week of October 12th. I think we're going to start out with a misdemeanor trial, which is a smaller number of jurors to see how that goes. And then if everything goes well and we're able to do it and get approval from the State Court Administrator's Office, then we'll expand that to felony trials. Every judge, every referee, every magistrate, we all have backlogs as a result of the pandemic, and we're working through those as best as we can. The one area where we have a significant backlog, aside landlord-tenant is kind of a separate matter, but the jury trial dockets for all the judges are backlogged because we haven't been able to do them. So we're really mindful of the impact that those delays have on everyone, and we're doing our best to address that. We've had great cooperation from the clerk's office, sheriff's office, prosecutor's office, public defender's office, county administration. Can't say enough about how everyone's working together as a team in these really unique circumstances. But that's my update. I just wanted to give folks really the the word that we're looking at having jurors come in that week of October 12th, and we'll see how it goes from there. But everything else, I think, is going according to plan as best as we can. Thanks.
Okay, thank you, Chief Judge. Appreciate it. For a situation update on Tripoli and nearby counties, Eric Pessel.
Yeah, thanks, Dirk. We thought we probably should put this in because it did make the news. The state put out a press release yesterday, and it does involve some counties close to us. So Berry County and Jackson County both have had a positive horse or a horse die that was positive for Tripoli. And then we just found out yesterday that there's a presumptive positive human case in Berry County. Actually, that is it's somebody that a member of my family knows, and this individual was pretty sick. His wife put some social media out that indicated spent 5 days in a coma at Butterworth, and is now at Mary Free Bed. And I can report that he is recovering, and it looks like he will recover, but he's got a long road to go ahead. I think the state has confirmed one positive, and in any case like this, they want to do a confirmation. So it's still considered presumptive at this time, but it will, more than likely, it looks like it's going to be our first human case. And so it's just another reason to understand that Tripoli can be very debilitating. I think that the death rate when a human does contract this and contracts the disease is about 40%, which is why it's very important. So the state is planning on doing aerial spraying in those counties where they've had either a human case or a case with a horse, which would include Berry and Jackson. And I believe aerial spraying starts tonight. But the latest information we had on a call this morning was that Berry and Jackson would not be included in tonight's spraying, but they are on the list, the docket, and that will be happening very soon. So I just wanted everybody to know we don't have a case in Calhoun at this time. And therefore, the guidance right now is not to adjust any sports schedules or any of our school schedules like we had to do last year. But if we are playing away, I've told our superintendents, if you're away at a school in Jackson or a school in Berry, you may be adjusting your time that you're playing to like a 4 or 4:30 p.m. football game to avoid that dusk to dawn time of being exposed to the mosquitoes. So Tripoli is back this year, and we're keeping an eye on it. And right now, it has not shown up in Calhoun County. Thanks, Dirk.
All right, thank you, Eric. Next slide, please. And with an update on Summit Pointe, Rebecca Fleury.
Thanks, Dirk. I appreciate that. I think we're all aware of the wonderful work that Summit Pointe does and the importance of mental health during this time where we're trying to conduct business as usual during a global pandemic. So it is incredibly important that we pay attention to mental health issues. Summit Pointe wants to remind us that September is Suicide Prevention Month. They have a wonderful program to spread the word about the importance of suicide prevention in their community chalking program. So if you're seeing chalk messages out there, or you would like to put chalk messages out there, please reach out with your messages of hope and contact Summit Pointe. They have lots of chalk to provide. So look for those messages. And then if you do pick up chalk and you're making those messages, please post those on their social media site that are provided here, #0suicide and #SPCCC. And just look for those and continue to promote the importance of mental health during all that we're trying to do during the pandemic. Thanks, Dirk.
Thank you, Rebecca. Next slide, please. We have a local businesses update from Kara Beer. Kara?
Hi, thank you. Just to reiterate the message in regards to Summit Pointe and the Suicide Prevention Coalition work that we're doing with the art project. Of the 30 suicides that were completed in 2018, the highest number is men 26 to 44. So that is your working population that is out there. And so it just really is in reiterating, we are in a global pandemic and a lot of stress has happened with looking at businesses and their jobs and making sure that they can provide for their families. So to keep reiterating that message is just very important. So thank you for talking about that today. In regards to our countywide workforce, you are seeing a lot of hiring fair stuff going on. Excuse me, I have a cold, not the Rona. But I will say that we are seeing a lot of differences going on right now. Our large employers are doing direct hires. They are utilizing their temp agencies as much as possible. We are seeing this across the board with both small and large businesses. But what we are seeing is that smaller businesses are slow to return to work and hire. So that is definitely playing a role in our recovery. And so with that, I will say that there are some definite challenges going on. But our Southwest Michigan Works office is doing a phenomenal job reaching out to folks, and so are all of our organizations that do hiring. They are putting jobs out left and right. At the chamber, we are offering free to our members an opportunity to post new job opportunities on there. We put it out, we announced it on Tuesday to our membership, and we already have 30 jobs that were given to us. So you're going to start seeing those getting posted on our website now here. If you aren't a member of the chamber and wanting to post that, there is a fee, but we will definitely do that. It is an opportunity for us to get more information out there. In regards to the challenges and barriers to the business success, there's a package of legislation going on right now, as many of you will know, and really looking at how to help business owners. What we have found is that we've got to push for protections on our businesses in regards to lawsuits, in regards to coronavirus. And so we also have a number of other legislations that are out there that if it is benefiting the business, we really need to start looking at those. This will be helpful for those that are looking at their businesses and how it's going to work. I put on there future of business and the lack of foot traffic. One of the things that we're seeing is that we're hearing from our smaller businesses that they're in survival mode right now, that they're working hard to make sure that they are open in 2020. It is very uncertain of what 2021 will bring. The lack of foot traffic is definitely having an impact. I will give a case in point, an example. In the downtown area, we have one of our larger employers, we all know which one that is not coming back until January 2021 at the earliest. And so we have a lack of foot traffic of people moving in and about of the downtown. We are seeing a lot of carryout business still happening, which is great. The capacity of only being 50% does play a role in this because we have a change of weather getting ready to happen. And so you have a lot of outdoor seating areas that are our social districts that were created by the city of Battle Creek have definitely been helpful, but with the turn of the weather coming, we do have some things to navigate through still because that number will still be low. We are trying to promote as much as possible the foot traffic, but what's happening is that if they're only getting smaller amounts of people within their stores because of the capacity, they're not able to make the money that they need. That's pretty basic information that I'm giving you on that, but that's where they're seeing it. They're trying to do a lot of advertising, trying to do a lot of promotions, but they can't do deep discounts because of the fact that they're still trying to make the revenue to pay the bills. Also, the reduced occupancy and still closed businesses. One thing I will reiterate on that, with gyms being at a lower level, as well as we have 3 in our community movie theaters that are still closed to the public. And so this is causing a great concern. One, because they have been closed now the longest of all of us. And it's really, it's putting a damper on that. We are starting to see those places close and possibly not open back up. So we really need to be watching what's going on with that and how we may be able to assist those. You also have places like in the county with the Bone Theater. They're trying to do a lot of pivoting to try and make it so it's smaller groups to be able to rent out that facility while carrying through a lot of that social distancing. Another issue that we're seeing with the businesses, excuse me, is that with the school reopening plans, while these are all great, all school districts have different plans. They are all in different ways. And what we are finding is we have a member that stopped in just last week and gave us the case in point. He is a single father of 4 students that are in 3 different schools. Not districts, but in 3 different schools, so elementary, middle school, and high school. And he said, and so I'm very thankful for my employer being able to work with me. And so our employers are definitely working with folks who are doing the virtual learning option as best they can. It does put a burden on the employer just because of the fact that they have things that they have to get done as well. And so there is some stress points at that point with the school reopening plans. Everybody's trying to navigate that as best as they can. What we're probably going to start seeing with the virtual component of people being able to work remotely, that has really been very helpful for folks. And so I think that will probably be a plan that will move forward throughout next year, at least until the spring, I'm assuming. I had a meeting with another person and said, well, we're working remotely until the beginning of the year. It's been really nice because that way I don't have to worry about the virtual learning component of my child. I'm already home, and a lot of people are taking advantage of that, of my coworkers. And so you are seeing a lot of that. We are seeing an impact. We haven't seen any major impacts yet of the opening of the fitness gyms and pools because they just opened this last week. I know a lot of people were excited to get back, but again, that reduced occupancy is where we're seeing the impact. And I think that's, and then also in regards to the guide to the PPP, now is the time to start getting that in. The paperwork is due soon. So I do have a guideline and a checklist for all of you who are looking at how to access the loan forgiveness program with PPP. If you are interested, I would be happy with sharing with that. I know that we have shared it through here. You can see it on the right of your screen, as well as I've shared it with Lucy and our PIOs. So I am open to any questions you may have. I don't see any.
Do we have any questions for Kara today?
And you might just not want to hear me talk anymore, so that might be it too.
All right, Kara, very comprehensive report, and thank you for that. We're going to move on to the next slide. This is comments from representatives. It's open to elected officials or the representatives, and we won't waste any time. We'll get started on this right away. Senator Bison, have you joined us today? One more check on Senator Bison.
Sorry about the delay there. I hope you guys can hear me okay.
Oh, you're fine. Go right ahead.
Okay, thanks. Just a couple of things. I don't have much. One is, I'm sure most of you have heard, but if you could pass this on to your circle, that would be great. Secretary of State's office, if you have, if your license is expired and it needs to be renewed, the Secretary of State's office has opened up additional scheduled times for people to come in and get their licenses renewed. So you can go to the website and check out the site there and schedule an appointment to get in before September 30th, that September 30th deadline there. The other thing is just an update on unemployment. One success, we had a constituent earlier this week who she had not applied for unemployment at all. She's been out of work since March, hadn't applied at all. She did just recently return to work. However, she was wondering if she would be able to get some of those unemployment payments from March, April, May, June. And so we walked her through and had her go ahead and apply. And it's looking as if she's going to get many of those payments that were coming to her. So if you know of anyone who was unemployed for weeks and weeks and weeks and was unable to get through to unemployment, they can still go in and backdate those dates on their application and see if they can get those funds. Even if they're back to work now, they can still go back and backdate all of those weeks and certify and be able to get those payments to help them out. So that's all that I have, unless anyone has any questions. Thank you.
Any questions for her? Okay, thank you for that report. We do appreciate it. We're going to move on to Representative Hatzma.
This is Paul Agnetuck, excuse me, in Rep. Hodgman's office. The House is in session starting, I think they started at 1 o'clock today. But running through some votes, there isn't a very heavy legislative schedule, but I think everybody's in Lansing to work on the budget process. It was reported in the last couple days that the leaderships, the governor and leaders in both chambers have come up with some ballpark targets. And nobody still has a very clear idea what the process will be for crafting of budgets, whether they do a normal subcommittee process. But I know Rep. Hodgman has relayed to both our team in the state house and also to the governor's office repeatedly about making sure some of those reimbursements to local units go through. I know one of the big issues was the hazard pay. There was it $360 million worth of requests for a $200 million pot of money. And I've definitely heard conversations among at least the House Democrats to try to get some more money put into that line item, because, you know, you're looking at like a 55% reimbursement for whatever was submitted, various units that had hazard pay requests. My understanding was those were going to be dispersed on schedule, and then you might get a little follow-up payment that brings you up to the full, what's looking like only about half of a reimbursement. But obviously the pressures on local governments are immense, and they are not going away anytime soon. So please reach out to us if you have specific concerns about budget line items. It's going to happen very quickly. There's not enough money to go around for everything, but if there's anything we can do to help pass that along to people, please reach out to us. Thank you.
Thank you, Paul, for that information. Very appreciated. Representative Hall. Representative Hall, or from his office, anybody there? Okay, we'll move on to county elected officials. Are there any county elected officials that would like to say anything today? Okay, we'll move on to tribal elected officials. But from the tribe today.
Good afternoon. This is Doreen Reels, Vice Chair of Nottawasippi Huron Band of the Potawatomi. We don't have any updates at this time. Thank you.
Okay, thank you for that. City elected officials.
Hi, this is Commissioner Gray, City Battle Creek. And I just wanted to say hello to everyone and thanks for the information. Also, for Eric, I had a question regarding, I see the number of deaths, thank God, is staying low. It's at 43, although, you know, any loss of life is a concern. But I do see, you know, that the number of cases reported have gone up. Can you speak to that a little bit? Is there milder cases being reported for those who have been infected with COVID? Are we seeing any trends or anything along those lines?
Yeah, thank you for the question. And what we're seeing in their data at this point in time is while our numbers are going up, the cases, and if you look on our website at the breakdown of the age groups, the main age group that has, I would say since July 4th until now, has had the most cases, and you can see that in our numbers, is that 20 to 29-year-old category, or younger folks. And so one of the reasons we're not seeing as many hospitalizations, and then of course, the lagging indicator after the hospitalization would be an increase in death. One of the reasons we're not seeing that is a lot of our cases since July have been of the younger population who maybe don't have the severe underlying conditions, which affects us in some cases fatally. So that's one of the explanations, is that we're just seeing our younger population coming down with this. We're seeing it on our college campuses around the state, and we're seeing it here as well in Calhoun. You can tell. I want to say that our 20 to 29-year-old, the last I looked yesterday or the day before, was very similar to, is almost as high as the highest age group that we've had yet. So somewhere 17% or maybe of our cases are in that age group now. And if you looked prior to July, I'm going to say that age group was probably down around 10%. So that's a significant factor. And one of the reasons the disease is any less harmful, it's that the folks seem to be a little more loose in their gathering and masking at that age.
I see. My second question was for Kara in the business community. I wondered if there was any additional supports, either through the city or through the chamber, that I have not been seeing or that I can help push as far as creating some digital opportunities where it makes sense for some of our businesses that are struggling with foot traffic, helping them pivot in technology wise. Are we thinking about that? Are we continuing to do things like that? And how do we get the message out about what's available so that those who need that training or additional technical support can find it?
Yep. So we have a number of different things that we've been working with local businesses on how to pivot in regards to setting up e-commerce, working with the Small Business Association, as well as our technical center, the SBDC, really getting that information out to those that may need it. We've been in connection with Northern Initiatives, who's working with up and coming businesses. A lot of what we're finding is that our businesses have pivoted pretty well in that regard. What we are finding is that they're still looking for grant dollars that is available, and not a lot of grant dollars are available currently. The CARES Act coming through possibly could be another round of PPP, which would be helpful. And that would be more of us getting that information out to our public to make sure that they know about that. But that hasn't happened yet. You also have one of the biggest things that I would say is that the Michigan Restart Grant just was announced on the 8th of September. We have a large number of businesses that did qualify for that and receive a $5,000 grant through the Michigan Restart Program. That was a program that was for us here locally. It was distributed through Southwest Michigan First. We do have that. There was and that was a great program that we were able to push out and get information out. A lot of our businesses are not looking for the loan component, which is a lot of folks there's two ways to look at that, but looking at with the businesses and really talking with them I'm proud of them for some of the decisions that they have made. Because of the unknown of not knowing what 2021 is going to bring, a lot of them held off on applying for the loan because they didn't know if they would be around in 2021, and then they would be on the hook for that loan. And so it really was an opportunity for them to look at the grant component, and we have a lot that we were able to give out. The Community Foundation, as you know, does have a fund available right now for folks to get in there. There's been advertising in a lot of different media spots to get that word out to help folks getting reopened. And that is also really great. Did I answer your question, Lynn?
Yes, thank you very much, Kara. Appreciate it.
Yep.
So if there's ever any time that I can help push it out through my network, please let me know.
Great, thank you.
Anything further, Lynn?
No, thank you.
Okay, thank you very much. We're going to go directly to Rochelle Nunley Hatcher. Rochelle, go right ahead.
Thank you. Thank you. Can everyone hear me? Whoops.
I can hear you real well.
Okay, thank you. I'm sorry about that. First of all, I did want to say, Kara, I appreciate you so much. You do sound like you need to get some rest and make sure you're taking care of yourself, okay?
Thank you.
You're welcome. You're welcome. But I did receive, I received some information from a couple of constituents that called me yesterday, and it was in regards to, and I just had to take note, so I'm not for sure because I had not received it, but it's information that they could have possibly received from the city regarding drinking water. And of course, during this time, and we're telling people to wash hands, and I think that the information that I received was that there was possibly some type of treatment that was not maintained by the water division during a certain period of time, as I'm told. And so I'm reaching out now to get a little bit more information or see if that, because of course we all know with water and COVID, some of my constituents are kind of concerned if our water is okay. Right now I'm on Ann Avenue and we are having street work done, which did our water, it's interrupted just a little bit, but the city is doing the work. But that all came, I think, at the same time. And so then this letter came out and the word came out. And then, of course, a couple of people on my block and around the corner are asking me. So I'm not sure who's here. I was actually going to reach out to you, Eric, first, the health department. But again, I realized we were having this meeting, so I just yesterday waited. Is this affecting us in some type of way, or is there a certain response? I need to know how I'm responding to them in a proper manner, or perhaps I can direct them to someone who may be handling this. Is anybody aware of that?
Yeah, Dirk, this is Rebecca. May I respond?
Rebecca. Sure,
Please do.
Hi,
Please.
Michelle. Thank you very
Hi,
much.
how you doing?
Good. How are you doing? I am happy to provide the letter that went out. There is nothing to be concerned about as far as the water. It had to do with an orthophosphate level in the city. And so every city water customer received a letter. I know I received mine yesterday. That's a FAQ. What happened? Why are you getting the notice? There is not a crisis, but just explaining all of that. And we've had a lot of calls. It has nothing to do with lead and copper. And this is, I think, the city working closely with the Eagle to make sure that, this is a requirement when there is a orthophosphate additive change or mishap at the city's Verona plant. But again, this is not a safety concern with the quality of the water coming out of the city. So I just want to make that known. But Rochelle, we're happy to answer those questions. I am going to make sure that you get a copy of the letter that was sent. And we're prepared to answer any and all questions.
And Rebecca, I probably have it in my mailbox. I just didn't go to it because, again, like I said, the front part of my house is getting work done, and I usually come in on the side off of Kindle. So when I got that, I was like, well, I'll check into it. And then again, like I said, I realized we were having this meeting today, so I wanted to come on board. So you are okay. I mean, and I'm sure you're okay with it, but I'm saying, is there any way that I can assist you rather than just, deferring those costs down to you. I can certainly, I can repeat exactly what you just told me, I guess.
I think if you have the letter in hand, it will answer any and all questions.
Yeah.
And you can also go to the city's website, particularly to the wastewater portion of our website, and you can scroll down to the Battle Creek treatment technique violation, and it will answer many of the questions.
That actually is perfect. Thank you, Rebecca. That's perfect. Thank you so much. That's it for me, Derek. Thank you.
Okay, thank you so much. And FYI, while you guys were talking, Jessica did a post on the chat box, so you can go in there. There is a link that could be used.
Great. Okay. Thank you, Jessica.
Thank you both. We're going to go right directly now to Kate Flores. Kate?
Thank you. I just wanted to follow up. I thought it might be easier, Eric, to follow up on the conversation in the chat, questions around testing. I wasn't actually referring to the Albion Clinic. I don't actually know a whole lot about that. More, I was just talking about school districts and testing generally and access to testing for students. You mentioned that quick testing for students is important. There are options out there that have a much better turnaround. So I'm just curious if you could elaborate more around that.
Yeah, I know that Grace Health has been working with us and some of the kids that we needed to get tested. So they've been an excellent resource. There's two pharmacies now, one in Marshall and one in Battle Creek, that are providing testing. They're listed on the state's website for testing. That has been having at least a 72-hour or less turnaround, which is what we're looking for. Been more around the 48-hour turnaround. So, and of course, still the hospitals, if it's somebody that's symptomatic, they're still doing testing and getting about a 24-hour turnaround for the PCR test. So there's testing out there available for us when we need to get maybe some kids tested because we're working through an issue at a school.
All right. I mean, and maybe it's more of a conversation for schools to communicate with families about what are the places that are having quicker testing. I mean, I can just speak from personal experience. My kids missed an entire week of school because of a cold, and we had to wait for tests. And it is what it is. These are the times we're in. And it stood out to me like, wow, we really need quicker testing. There's going to be a lot of absences and a lot of issues if it takes so long to get test results back. Maybe there's communication schools can also be putting out to their families about, where access to some faster testing. So thank you. I appreciate it.
You're welcome.
Anything further, Kate?
Nope, that's it. Thank you.
Okay, thanks very much. We're still in the category of city elected officials, so I'll run that one more time. Are there any city elected officials that would like to address this group?
Hi, this is Susan Baldwin, Battle Creek City Commissioner.
Hi, Susan.
I just want to thank everyone. We have not had one of these meetings in a while, and this is very helpful. I think that there's been some slacking off by some folks about taking care and washing hands and wearing masks. And I started to see those numbers go up of cases and thought, well, let's check back in because there's a lot going on. And I do appreciate everyone stepping up and providing us this information. Thank you.
Well, thank you very much for that, Susan. Staying with the city elected officials, do we have anyone else that would like to address the group? Okay, then we will move on to township elected officials. Okay. And we'll move on to village elected officials. Okay. Pretty much everything in chat has been taken care of. Thank you, Eric, for that. Most of them were health-related questions. I would like to reflect back or refer back to our unified command team to see if they have any final points of interest they'd like to discuss or anything they want to bring up as a result of our conversation today. Kim Archambault is sitting in for Kelly Scott, our county administrator, of course, Rebecca Fleury, City of Battle Creek manager, and city manager, and Eric Pessel from the health department. Three of you have anything you'd like to add?
This is Kim. Nothing for Calhoun County. Thank you.
All right. Thank you very much, Kim. Rebecca?
No, I think we're all set. Thank you very much for participating, and thanks, Dirk, for moderating.
Absolutely. Very welcome. Eric.
Yeah, just one last shot. I said it in the chat, but I would like everybody to remind them that get your flu shot this year. We want to make sure that we don't have a very serious flu season on top of coronavirus. So please, everybody, get your flu shot.
Great message to end on. Thank you so much, Eric. On behalf of the Unified Command Team, I'd like to thank everybody for joining us today, and please stay safe. Thank you so much.